right, let's bring in Dr. Joe. Dr. Joe Congini, Akron Children's Hospital Sports Medicine Center. And, Joe, what do you got on the ledger today for us, my friend?
Well, I kind of want to get everybody involved here, and the winter athletes in high school that are the closest to get down to the state tournament and get started are the swimmers. And so I want to talk a little bit about swimming injury, the most common swimming injury that we see. The swim state championships are held in Canton, Ohio, if anybody's ever interested. The nicest pool, from what all swimmers tell me in Ohio, is still the Branham Natatorium in Canton, right down by the Hall of Fame. And they'll be down there in a couple of weeks. And so by now, hopefully, they've dealt with some of these injuries. But one kind of interesting thing, again, experience shows me, one pattern that I've seen, Ray, is a lot of my distance runners who start to break down with chronic injuries or mechanical issues, many of them use their endurance skills and jump in the pool and become really good swimmers. And another pattern is the gymnasts who have a high injury rate, or they start at a really young age. They learn all that great body control. Many of them have gone on to be great divers. I remember one of my great gymnasts from Firestone became a diver and was a state champion within 2 years. So the point of the matter is, if you're in a pattern of where you're having a lot of injuries and stuff, don't give up on all sports. Sometimes you can switch to a sport where you can use those skills you developed. And swimming is a great skill, but a real common problem, as you might imagine, Ray, is shoulder injuries. And everybody, when we talk about shoulder injuries in sports these days, wants to talk about the labrum. And this is not a labrum issue. Labrum injuries, labral tears, are very rare in swimming in the pool, almost never, and very rarely. Much more commonly, and in fact, much more commonly in all athletes, is a condition known as impingement syndrome. So we like to use fancy words in medicine. Why impingement syndrome? Impingement means pinching. And when these athletes are in the overhead position, so the arm is held above the shoulder overhead, and with our swimmers all the way overhead, with our pitchers, our throwers, our tennis servers, and volleyball hitters overhead, they pinch an area between the top of the ball and socket and the shoulder blade. It's only about 2 inches wide, and within that little area is the rotator cuff muscles and the biceps muscles and the tendon. And when they get overhead over and over and over again, as our swimmers swim a lot, they pinch that area. They have pain overhead. Many times they come in our office this time of year, Ray, they can't even lift their arm above the level of the shoulder or neck because it's so painful. And they think, oh, my gosh, I'm done. I can't swim. How am I going to swim? I'm in so much discomfort and pain. It is not bursitis. Kids don't have a developed bursitis until 20 and beyond. And so it's not as amenable to injections. We don't inject them as much as we do our weekend warrior athletes. So our weekend warriors like Ray Horner and Joe Congini and others like our age, we can get this problem from raking or mulching, or really common is a lot of people would start their New Year's resolution. They'd go to the gym and start doing all these overhead presses, and they would, about 3 or 4 weeks later, about now, they would be in seeing somebody because their shoulder is sore and they can't lift overhead. And those people do get bursitis, and injections can help them, but not our young people. We have to get them some period of rest. So that's hard, relative rest. You do not want to put them in a sling. If you put them in a sling, they'll get stiff and they'll never swim in the important meets of the year. You need to get them in some sort of relative rest. And we cross-train them on an exercise bike or on a stair climber to keep their cardiovascular going. We throw them in the pool with a kickboard so they're not swimming repetitively overhead. They're working on their kick and their aerobic capacity. We don't want to lose that aerobic capacity. And then we gradually return them back when they're strong again so that they're at peak performance for the important meets of the year. We might even still in this population use a short course of anti-inflammatory medicines a bit. We don't like to use those as much anymore, but the physical therapists help a lot. They have all kinds of tricks to reduce the inflammation in the overhead position. But most importantly, they strengthen a group of muscles behind the shoulder called the scapular stabilizers. And when these kids are really a lot stronger, they swim at their best. So we gradually hold them off with relative rest, get them back in the pool before the big meet, and try to finish the season with these kids, because there's no real long-term implications of impingement syndrome. But the number one shoulder problem in athletes, and weekend warriors too, is not the labral tear. It's an injury to the tendons, and in adults, the bursa, called impingement syndrome.
Boy, Joe, I needed this advice Monday when I had the snowblower out there for about 2 or 3 hours, my friend. My shoulders are still hurting.
Me too, and the back, and I heard you give a really nice talk yesterday about if you had related to chest pain and everything like that. Wow, that was a big. So I don't remember one that big in a while. You're the history buff, but boy, we really got hammered. And I literally could not get out of my driveway with the drifts and stuff until we got it cleared.
Yeah, I know. Out in our area, I measured in our driveway. We had about 16 inches, and I know those stories are pretty similar in the region. Okay, thanks, Joe. Appreciate the visit, my friend. We'll catch back up with you next Wednesday.
Have a great week, Ray. Thanks.
You too, my friend. Dr. Joe Congini, Akron Children's Hospital Sports Medicine Center. He's been visiting us for about 25 years here on the Ray Horner Morning Show.